Welcome to the Restep DVT system training video. In today's training session, we will talk about the importance of DVT prevention, as well as the clinical use and application of the Restep system. To provide a better understanding of DVT prevention, terminology used often within the clinical setting will be highlighted. A thrombosis is the formation of a clot in a DVT, or deep vein thrombosis is a clot located in one of the deep veins of the body. The deep veins most commonly affected by clots are the femoral vein, located in the thigh, and the iliac vein, located in the flank region. With the presence of a damaged blood vessel, stagnant or slow blood flow, and the body's desire to form clots at a faster rate, a DVT can form and easily cause patient harm. As these clots grow within the body, pieces can break off and travel to vital organs, such as the heart or lungs, and is many times referred to as a pulmonary embolism. The Restep DVT system is used in the clinical setting to help prevent blood clots through leg and foot compression. This compression creates a massage-like movement designed to prevent blood from laying stagnant and potentially forming a clot. This system can be used alone or in conjunction with other preventative measures in the clinical setting, such as walking, compression stockings, and medications. Even with these preventative measures, patients still have a 3% risk of acquiring a DVT. Patients at risk for DVT are those who are sitting or lying for prolonged periods of time, diabetic, obese, pregnant, and those who smoke. Sitting for 4 hours or more reduces circulation in legs by 50%. Because of these risks, most areas of the hospital utilize these devices for preventative therapy. Certain medical diagnoses limit the patient's ability to utilize any type of DVT compression systems. This therapy should not be used with patients that have the following diagnosis or condition: severe arterial sclerosis or active infection, suspected or known DVT, severe congestive heart failure or any condition where increased fluid to the heart may be detrimental, existing pulmonary edema, or local skin or tissue conditions in which garments would interfere. Your Restep pump kit will include the Restep pump with bed bracket, a 6-foot tube set, carrying strap, battery, and power adapter. Restep offers 4 different types of garments: the calf garment, which is up to 22 inches in calf size, the bariatric, 22 to 27 inches, the thigh, up to 32 inches, and the foot is offered at a universal size. The Restep garments are made from a polyurethane material that is thin and lightweight relative to other sleeves, and designed to limit discomfort patients may have from wearing compression sleeves. Restep compression sleeves are among the thinnest of garments on the market today and have been designed with comfort in mind, which should encourage greater patient compliance. They are latex-free, and the garment bladders contain no PVC, presenting a more environmentally friendly solution for hospitals. The inflation time for the Restep calf, bariatric, and thigh garments is 12 seconds, and the deflation time is 48 seconds. This alternates between the legs every 30 seconds and rises to a pressure of 40 millimeters of mercury. The inflation time for the foot garment is 12 seconds, and the deflation time is 48 seconds, but it fills to a pressure of 80 millimeters of mercury. Because Restep offers uniform compression, all bladders fill at the same time, unlike the sequential compression devices that usually have 2 to 3 bladders that do not inflate simultaneously. The adapter inlet is located at the top of the pump. Insert the adapter output into the adapter inlet. Plug the adapter into a wall AC outlet. The Restep system offers an operating user manual that provides complete information regarding system use, garment application, and troubleshooting scenarios. Let's now discuss the system controls of the Restep pump. Press the power switch to turn the pump on or off and to start or stop the pump. The alarm graphic highlights the function of the high-low pressure alarm indicators. These alarms are both visual and audible and alert the user to check the function of the pump and garments. If the pump alarms, make sure garments have no tears or holes, are attached properly, and connections are secure and not kinked or bent. The low pressure alarm is a solid yellow light with a constant audible alarm that will sound when no garment is attached or too loose. A solid yellow light will display with a beeping audible alarm if the pump is not providing adequate pressure to the garment. Check the garment for tears and replace if needed. The high pressure alarm is a solid red light with an audible alarm indicating high pressure or kinked tubing. A solid red light with a beeping audible alarm indicates the garment is not deflating properly. Check to ensure that the tube set is not kinked, bent, or blocked, and replace the garment as needed. If the alarm persists after garment change and 5 cycles, remove the pump from service and notify your facility's biomedical department. The mute key silences the audible alarms for 3 minutes, at which time it will re-engage to notify the user of future alarms. The battery charge indicator will blink green when charging and plugged into a main power source. When the battery is fully charged, an audible beep is presented once and the battery charge indicator will remain solid. The alarm will sound during battery-only pump operation when the battery is near depletion. The following actions will be initiated by the pump when this alarm is activated. A solid tone, audible alarm will begin and continue for 10 minutes. This alarm cannot be muted by pressing the mute button. The garments will be vented immediately. The pump operations will be suspended for 10 minutes. If the user connects the AC adapter power supply to the pump within 10 minutes of alarm, the pump will automatically resume operations. If the AC adapter power supply is not connected to the pump after 10 minutes of alarm, the pump will completely power off and will not power on until the AC power supply is connected to the pump. If the interval between achieving full battery charge to a critical low battery alarm begins to be noticeably shorter over time, the battery pack may require replacement. If a new battery is observed to have the same short battery operation runtime, there may be an internal pump fault indicating that the pump may need servicing. Remove the pump from use and notify your facility's biomedical department. Do not continue to use. The garment type button is used to choose garment setting. The default setting is leg garments, which is the setting used for calf, bariatric, and thigh garments and gives a pressure of 40 millimeters of mercury. Press the garment type button to choose foot garments. This gives a pressure of 80 millimeters of mercury. The garment mode button is used to choose a single garment. The default setting is for dual garments. Press the mode button to choose a single leg or foot garment. Placing the pump on the footboard allows for easy access and full view for staff assessment. Calf garments may be used on either leg and should be removed regularly to inspect the skin. Unfold the garment and position the inflatable center bladder directly behind the patient's calf. The outlet tube on the garment should not be in direct contact with the patient's skin. Snugly wrap the garment around the patient's leg and secure the hook tabs. Attach the garment to the tube set by pushing in the silver latch on the female tube connector and inserting the male garment connector firmly into the tube connector until a click is heard. Foot garments may be used on either foot and should be removed regularly to inspect the skin. Unfold the garment and position the inflatable center bladder directly below the arch of the patient's foot. Snugly wrap the garment around the patient's foot and secure the hook tabs. Wrap the ankle straps around the back of the ankle and top of the foot. Attach the garment to the tube set by pushing in the silver latch on the female tube connector and inserting the male garment connector firmly into the tube connector until a click is heard. Foot garment should be removed prior to patient ambulation or transportation. For the thigh garment, the inflatable bladder should be directly behind the patient's calf with the cutout behind the knee. The outlet tube on the garment should not be in direct contact with the patient's skin. The tube should be connected to the tube set in the same manner as the other garments. The Restep garments will be collected in the same receptacle as other DVT compression sleeves. Only compression garments should be placed in these receptacles. The pump and pump tube set should be cleaned according to hospital guidelines and placed back in use after cleaning. Restep is a next-generation DVT therapy developed by experts with patient comfort, clinical convenience, and sustainability in mind. The thin, lightweight sleeves are designed to be comfortable relative to other sleeves available, making them likely to increase patient compliance with DVT therapy prescriptions. Restep sleeves are environmentally responsible. They are made from polyurethane rather than PVC and are designed to be reprocessed up to 4 times, reducing the amount of waste sent to landfills. The pump is small, lightweight, portable, and quiet in operation with a rechargeable battery. It can be easily maneuvered around the bed or when moving a patient between floors. Restep allows for flexible contract terms with the convenience of a single supplier for new and reprocessed garments. For more information regarding Restep, instructions for use, product accessories, and ordering information, please visit restep.stryker.com.